Go.
OccMed For DCs is an organization for doctors nationwide, for chiropractors and nurse practitioners. What we do is we hold your hand through the process of getting certifications, getting training, equipment, and also the hassle factor of equipment and how to service equipment or getting equipment serviced, and the database that we have of forms, paperwork. It's all been created for you, and all you do is copy paste it off of our forms right onto your letterhead. We're also there, Raker and I are there 24/7. You can call us anytime if you get in an exam room with a driver who's had a recent heart attack and they've had open heart surgery, and you're not sure if you can certify them. You're going to call us on the phone, and we're available for consulting purposes.
It's been a benefit to me. I've called several times or texted,
Yeah.
and Rick said, just call me. And so one of the things that I love about OccMed For DCs is the Google Drive access that I have to so many of the different files that we use with y'all. Everything from marketing to equipment to purchases to training. It's pretty much all inclusive. So it's been a huge benefit for our office, and it's made a significant difference in the total available income that we're generating as a result of our connections.
And we teach you the language and the lingo and the way to talk to businesses. We teach you how to do marketing to businesses. How do you approach them? What do you say? We have scripts that are tried and true that we've worked on for 20 years on how to close that deal, to close that sale. It's not enough to make a phone call or just get on the email list. You've got to go out there and shake their hand, and we teach you how to do this without fear of rejection or without fear of loss. You're going to have the confidence, and we build you the confidence by doing some practice sessions with you. We also have videos of doctors that we've videoed going through the process of how to do the cold calling techniques. And believe me, no one else is doing this. Concentra's not doing this. Nova's not doing this. Other occupational doctors are not doing this. But believe me, the business managers, the HR managers, the safety personnel of the companies, even the owners of the companies, they appreciate you coming out there caring enough to share with them how to save the money and how to save them time.
Absolutely, and as an individual practitioner, one of the benefits of OccMed For DCs is you give us the basic outline and samples of brochures and letters and obviously the scripts, but the core materials that you need to go out and carry with you, in addition to the knowledge of how to present that, but the tools that we have
Right.
are also given as well. So that's really an awesome opportunity for any doctor that wants to join.
And two, Doc, I think one of the best benefits of being a member of OccMed For DCs is you have a network of family. You have a group of doctors in the United States that are a few months ahead of you, maybe a year ahead of you, maybe 2 years ahead of you. And during our lunch and learn that we have every week on Tuesday from 1 to 2 p.m., we all get together. And there will be 50, 60, 80, 100 doctors throughout the United States on a Zoom call, and we produce a 1-hour show called OccMed For DC's Lunch and Learn. And we have special guests come on there. We have other doctors that will talk about, hey, how do I get business? What is, or this is what I do to get business. This is how I advertise. And so this family that we have is all about helping each other. And I think it's the best thing that we provide for our doctors.
I agree that it's a big asset. I rarely miss the Tuesday course. I'm on Central Time, so it's from 1 to 2 p.m. for me, and so I'm there pretty much every week.
But if you do miss it, see, we record every show, and it goes into the Lunch and Learn archives. And so if you say, well, I'm working between 1 and 2 on Tuesday, I can't watch the show, or I can't be there, you can access it through our database as a member, and we have over 3 years of shows. Because it's in a database, you can type in the subject you want to cover, type in the word marketing, and it'll pull up every show where we talked about marketing. or it'll pull up every show where we talk about how to do a DOT physical, or how to do pulmonary function, or audiometric testing, or blood surveillance. And so that's the great thing about our Google database is that you can find things very quickly and go right to the video and stream it straight from our Google database onto your laptop or computer and watch the show there.
Yeah, that's been a big help. I can't tell you how much I appreciate the hand-holding that I've had, and there's no reason to reinvent the wheel, that they have successful actions and tools, everything from the promotion and marketing to the scripting to the know-how to the equipment that's necessary to be utilized. So I mean, it's a no-brainer. You need to join. You need to join today.
One other thing, y'all. One of the things that we have, a lot of people don't realize, we paid over $15,000 for a lawyer to write an employee contracts. You see, when you have your business, you need standard operating procedures, and each employee in the business, from the front desk to the medical assistant to the associate doctor to the chiropractor to the nurse practitioner to the supervising physician, they all need a contract and they need to have direction. So we've built all that for you. And why is that important? Because you have non-disclosure agreements, non-compete agreements inside there that has been thoroughly looked at by a lawyer. Those forms are available for OccMed members as well.
That's really exciting. You know, here I've been in practice close to 39 years now. And over the last 39 years, I found that there's some real common problems that pretty much every chiropractic office has. The first one is enough new patients to sustain the growth and development of your business. The second one is procedures and how to take care of the people when they come in. The third one has to do with administratively handling the process of you know, like you just said about the contracts that's necessary to be able to bring people in, and the last one is just hiring and firing. You know, those are some things, and I don't know that there's a lot of information on the hiring and firing, but if you have the right administrative tools, it works out no problem.
Yeah.
So y'all got pretty much all the bases covered.
We have created a 75-page policies and procedures for each part of this business in occupational medicine. And so when you train that employee, you need to train them right. They need to have a policy that they sign saying this is what you've agreed to do. You're not allowed to step outside that policy. You're not allowed to do your own thing. You have to follow these procedures and policies as they're written. Because as you know, doctor, we're required to follow the law.
Right.
And so when that happens, those people that work under us have to follow the law as well. This brings me into another section I like to talk about, is that many of our doctors have a fear of liability to do this business. And they're like, well, I'm afraid that I don't have the skills or training to do this work. Or can I do it under my license, under my scope of practice? Well, we're telling you, you can. In all but New York, Michigan, and Washington, you can do DOT physicals, drug, alcohol testing, and other procedures, occupational health related services. And all we really do is we're doing evaluations and we're doing reporting. So when doctor does a DOT physical, he does the physical exam according to the fmcsa guidelines and his training and his experience, and then he makes a determination, a medical determination on the length of time for that driver to be certified, and then he certifies the doctors. And then he notifies the company they work for, or the federal government under the FMCSA notification. So really all we do is evaluation services and reporting. You're not performing any treatment at all. Now, if they have a chiropractic disorder or problem that needs to be addressed, you can address that with them and say, by the way, this is something we need to get fixed. And that would be on a different office visit. They would need to schedule for a new patient exam, you see.
So a typical DOT exam in our office runs pretty smoothly because we've been taught by OccMed for DCs how to process through everything. We actually use something called 3B Exam, which is one of your affiliates. The driver is sent a link. They fill out their part before they arrive. They love that because it saves a lot of time from them having to sit in the office and fill out a bunch of forms. We usually bring them back immediately. We give them a cup, they pee in it. We do a urine test. We immediately check their vision. We go ahead and get their blood pressure, height, and weight. And then typically after that, they go into a room. We also, we look at we do a postural assessment. We have digital posturals exam, which helps me kind of tie together everything that I do as a chiropractor. But it also gives me a little bit more health information that might ascertain weaknesses that they may have, limitations of movement or function that I can ask them about. And so, we go through the process of the exam. We look in the eyes, we look in the ears, we listen to the heart, we test reflexes, maybe look for hernia. And basically, it's just a simple exam that we do that we might do normally, and we've been trained to do on any number of people. And then once the guidelines for FMCSA is pretty straight on, if their blood pressure is elevated, you give them a 1 year physical pass. If it's below they have a peak range that they can't go beyond. And if their vision is okay and they are under 20/40 on their vision and their hearing is sufficient.
So you're just following guidelines?
Just following the guidelines. And the guidelines are pretty straight, and all you got to do is just know what they are and practice what we've been taught. So
there are going to be times when you can't remember the guidelines, and so what do? You call me or Dr. Recker, and we're right there able to help you, give you that information.
And they've changed a couple of things every once in a while. Like, for example, used to, if you were on insulin, you couldn't get a pass. Now they allow it. Used to, if you had monocular vision, you couldn't get a pass, or you had some other kind of limitations. The FMCSA is interested in allowing drivers that want to drive, that are capable of driving, to be able to drive, even if they may have certain limitations that in the past.
So as a doctor, you're giving discretion.
We're giving a good
So you're giving
discretion.
some wider discretion than what it was in the past.
Right.
This brings me into another question, Doctor. From a driver's point of view, let's talk about the people we see as drivers. Now, the biggest complaint that I get from drivers every year is they're making me wait.
It is 11:57.
Okay.
We're at noon, so we've got about another hour. Let's start let's start over.
Well, that's okay. Go ahead. 3, 2, 1. Synchronize. Go ahead.
Doctor, thanks for being with me today. And as you know, I work with a lot of drivers, a lot of companies out there, and the biggest complaint that I get from companies and drivers, individual drivers, independent drivers, is the exam costs too much and they're making me wait. The third thing is they don't do a very good exam. I want to talk about what you do here in your office and what's important to you for the drivers.
Well, the real key for a driver is for me to ascertain whether that they're going to be able to safely drive a vehicle over the road. That's sort of the FMCSA guidelines. They want to make sure there's safety involved. I mean, that's the purpose of the exam. So when I do an exam, that's my predominant interest, is determining whether or not they can actually do the job safely. A couple of things that we see that can create problems are many times, unfortunately, drivers are busy. They're eating on the road. They're on the go. They don't, they're in the road on the truck for many hours at a time, and hardly any of them have a primary care doctor. And so a lot of times they have these underlying health issues they may not even be aware of. So we try to look at and investigate as much as we can and give them good health advice. One of the more common problems that we see is a lot of drivers are dehydrated, either for drinking too many energy drinks or too much coffee and not enough water. When that happens, we see a lot of protein spilling over into the urine, and it's a simple solution in most cases, just to tell them to drink more water. Many times also, when protein comes through the urine, the kidneys are basically just a fence, and it allows you're supposed to keep certain things on the inside of the fence. Now, you're from Texas, so you know you've seen a lot of fences over the years.
Right.
And if there's a bunch of cows in the road and we're driving down the road and we come up on some cows, what I can tell you for sure is that cow obviously got out of the fence.
Right.
But do we know why or how? Not always. But if they're associated with a high specific gravity, we know their urine is too concentrated, and a simple solution is just drink more water.
Right.
That's one of the things. The other thing is because of the driver's propensity to not eating correctly, many of them are carrying more weight on their frame, and they can develop something called metabolic syndrome. Their blood sugar becomes out of balance. They start developing problems, and we find that in a urinalysis when they have high glucose in their urine. And if that's the case, it's sort of a red flag from a health standpoint. It's probably one of the most serious problems that a driver could have, because it can cause all kinds of issues relative to even the possibility of passing out while you're driving. So we look at that, and when I normally see that, I want to check, and I ask them, do they know what their A1C level is? So that's another little ancillary test that we've added to be able to offer that service to drivers to check their A1C. Instead of them having to leave and go to their medical doctor and wait in the medical office and have to pay another fee for another lab test and another office visit to another doctor, I can just charge them a simple fee for an A1C, and it makes it more convenient for the driver. So one of the things I'm real concerned about is trying to make it convenient for the drivers.
Right.
We don't have the drivers wait. They're not in our office with a bunch of sick people, and we want to try to do what we can to make it convenient. My objective is to get them back on the road driving safely. And I don't want to necessarily fail somebody, but I have to follow the guidelines, and I try to make it really clear as to what, if there's an issue, I try to explain it, and I say, do you understand why we're making this determination?
Right.
And then they say, I want them to say yes.
A lot of companies come to me and they ask, is your doctor driver friendly? What does that really mean?
Well, it's like you're conscientious of the fact that this is a person, and that they have a job and a livelihood, and they have bills to pay, and they have a job to do, and it's just basically being treated the way you'd want to be treated.
Right.
And
I think the biggest fear is they're going to lose their source of income, and that anxiety builds and builds and builds, and they're like dreading this appointment with their doctor. Okay, they have to do it once a year, once every 2 years, and they actually lose sleep over it. They get sick at their stomach, and that actually raises their anxiety level up.
And unfortunately, their blood pressure.
And what I have seen with a lot of these drivers is when they build a level of trust with the doctor, that he's there to help them, one, become healthier, and two, we want you to keep your job. I'm not here to see that you fail. If that's not what they get at these large corporate chains that are nationwide, they don't really care about them. They say, well, we don't really give a crap whether you're driving or not.
Right. And they don't really care how long the employee has to wait in the waiting room, and they don't care about the cost that's set by corporate, and they really definitely don't care about the health of the individual. One of the things, the comments that we get a lot is that all your folks here are really, really nice. And that's what we are after. That's what being driver friendly is just being nice to people. And so I think all of the OccMed for DCs are going to be in that same category, is that we are care providers. We provide care. And it's the reason we provide care is because we care. We care for the drivers, and we care to make sure that they're able to get what they need when they come in.
Now, we've seen this with a lot of the larger corporate chains in America with urgent care centers, that they're like, well, this is a hard and fast rule. If you're overweight, you automatically have to have a sleep study. That's another fear our drivers have out there, is that I don't want to have a sleep study when I don't have sleep apnea. What do you do when someone comes in and that's one of their fears?
Well, I mean, that is sometimes an issue with drivers. There's a common score that we look at as part of the exam. They fill out the questions. So let's say they're over a certain BMI, they're above 50, they're a smoker, they're on blood pressure medicine. And then, we ask them, do you snore when you sleep? And, that it kind of puts them up into a moderate risk category with all those things that I just mentioned. We also look at the opening of the inside of their mouth. There's a name for that test.
Man potty.
Mm-hmm. So we look at, I don't try to confuse the drivers with my technical knowledge, but I just want to get a picture of the inside of your mouth and I want to show you this. And here's the guidelines. Where do you match up? And if they fall below a certain opening space because of their weight and it closes up their mouth, and I try to explain it to the driver like this, like, look, nobody wants to get a sleep study, but I have never had a driver come back that's had a sleep study that was disappointed that it makes such a difference in their life.
Right.
And I explain it to them like this. You know how important a fuel-air ratio is for the efficient running of your vehicle? Your body's the same way. You need enough oxygen to combine with your fuel to metabolize and to make your body operate the way it's supposed to. And if you're getting insufficient oxygen, you're putting more stress on your heart, you're putting more stress on your lungs, you're creating a lot of different problems that can be avoided. Most people who end up with a sleep study that may or may not require CPAP, but if they ever do require CPAP, they never want to go without it because they feel so much better.
You know, I'm a doctor, and before I started doing consulting, I had my own practice. We were in DOT physicals, and I had this one driver come back in, and he said, "Doctor, I want to thank you for saving my marriage." And I said, "What are you talking about?" And he said, "You insisted that I get a sleep study, and you got me set up on a CPAP machine, and that saved my marriage. My wife is now sleeping with me again. She was sleeping on the other side of the house. So were the kids. Even the dog was wanting to sleep outside because I snored so much. But it has done a tremendous job with my marriage." And I never thought of it, but it's true. There are so many ways getting treated for sleep apnea with a CPAP machine can change your life. It really is. So I don't want the drivers to be fearful if they can get testing cheaper. Now, I'll tell you right now, if we sent you to a pulmonary specialist or a sleep study specialist, you're talking $4,000 or $5,000 for a sleep study. Y'all can offer, and I know that our other doctors can offer this test now as a home study.
Yeah.
As a home sleep study.
We do offer a home study for our drivers. I ask them, would you rather go in the hospital and get this test done, or would you want to do it at home?
Right.
And I would say 90% would prefer to do it at home.
Right. And so they get their test done at home, and we're able to get the data from a sleep specialist who reads the report, and then we're able to report back to the driver whether they have sleep apnea or not. And then the doctor will authorize a specific level of treatment, whether it's a CPAP or BiPAP device to help treat their sleep apnea, correct?
That's correct. Now, there are also mouth guards that can open up the air pathways, and so there's a third option. If you work with a local dentist, that he has to have a sleep study to document that, but you can go to some dentist and they can make these mouth guards.
Okay, mouthpieces.
Yeah.
Okay, awesome.
So there's an alternative to that if they're not, if it's not too complicated.
Right.
So those are all options. The sleep study, home sleep study that we use, they work with the employee, the driver, to get a CPAP. Now, one last thing about that the drivers need to know about sleep studies and about CPAP usage. Once you're been documented that you need a CPAP, it's a fmcsa requirement that you are utilizing the CPAP that has been recommended. Yeah. So we require our drivers to bring in or send us a report of utilization, and the requirement is you have to have 70% of the time. Most of them are 95 or higher, right. But we have to have that as part of the documentation to get you your 4-year-long pass.
Right. Well, FMCSA and federal law says that if a driver has been diagnosed with a disorder called obstructive sleep apnea, and he's given a prescription for a CPAP machine, he is required, and they see a CPAP machine as a form of therapy, as you know, and so he is required to use that CPAP for a number of hours, a minimum of 4 hours a night. Now, most drivers say, I sleep with it every night, 8 hours a night. And that's the ideal, right? But once they're diagnosed, they're going to have to prove to the certified medical examiner that they've been in compliance with the law, which is ongoing usage, right? Now, that doesn't mean 30 days before they see the CME doctor, I'll start using it and give them a 30-day piece of paper or data sheet and says, see, I've been doing it for 30 days, okay? And another thing is the doctors now, or the forms now, can tell if that CPAP machine, if that mask is hung up on the bedpost or not, or if you're actually using it. And so we can determine whether you're in compliance or not with the federal law on your use of your CPAP machine.
Most drivers are appreciative of the
Oh
CPAP
yeah, they are.
because how much better it makes them feel. It's just you need to make sure if you're going in for a DOT exam that you have been prescribed a CPAP, that you bring the report in. They're all computerized now. So.
Right. What do you do if a driver says, I just can't get it to fit right? I don't like the way it fits. It bothers me at night, and so what can be done if their mask is not fitting right? What do you recommend?
Well, if they have their device, we could have them bring it back and we could look at it. Maybe they're not wearing it properly. Sometimes some simple adjustments. Again, it goes back to driver-friendly approaches to dealing with things. It's kind of like, what can we do to help you be able to pass your exam and to live your life in a healthier way? I'm remembering, too, another thing, that there's a service that's offered through some of your members in our affiliation with you, that they offer some ongoing wellness testing and consulting work with the drivers, and they do that by phone or online. Is that correct?
That's true. That's correct. Now, consulting services is very critical, but I will say from a personal experience, I have a CPAP, and I struggle with using one. It takes weeks and weeks to really get used to using it. And there are like 12 different styles of masks now. Back in the old days, you had one choice. Well, now they have nasal cannulas, they have a nose mask, they have a full face mask, they have a half mask, they have a mask that comes down in front, they have a mask that goes across the top, out the sides. So there's no excuse for you not finding the right fit for a mask.
Yeah.
But you've got to have somebody there to help you with that and find that right fit for you.
Well, the company that we use for the home sleep studies, they work extensively with and communicate directly with the drivers,
right,
and help them find the right device for them. So we're fortunate. We've got somebody that can participate with that. All I do is write the script, and we send that off to the guy, and then he reaches out, contacts them, make sure they got the right shipping address. Comes in a box. They get it. They strap it on. There's about 3 pieces to it. You get a finger measuring oxygen, a little computer that straps around your chest. And
they wear that all night.
And they wear that all night, a nasal cannula. And then he comes in and talks to you when you got it set up. So he documents that it's you on the machine,
right,
as part of the requirement for the test. And so he'll kind of video chat with you. And
like through a Zoom call?
Well, just,
or
Facebook,
FaceTime.
Live or something.
FaceTime, yeah.
So he'll make sure you're doing it correctly, or makes little corrections on it if you need it. You sleep all night, and if you slept 4 hours, then you basically box it back up and put it back to them, and then within a few days you got a report back.
Now, a lot of questions drivers have is, and I see this from independent drivers, is what's this thing about consortium? And I own my own truck, and my wife drives the truck. Do I still need to be in a consortium?
My answer to them is yes, and the reason is because FMCSA no longer allows an individual driver to submit their personal results for their drug or alcohol testing. It has
so
to
does this mean I'm going
to
to have to get tested every quarter because I'm an individual driver?
If
I'm only one driver, I would be the only one getting testing, right?
Well, if you're in a larger consortium group, like we offer in our office a consortium group, and we actually have different consortiums depending on the company and the size of the company. And then basically what happens is you've got to have somebody to administer the group. You have a census list of the employees, and FMCSA requires that 50% of the drivers have a drug screening annually, and 25% have an alcohol breath analyzing test. And so your name is put into the random
To a large pool.
to a larger pool. So that means you may go 2 or 3 years and never have to have a test. It possibly could mean that you have to have 2 in a year. It just depends on the random draw.
On the draw.
Yeah, and so it's basically randomized, and it pulls your name up out of a hat, so to speak, out of that pool of group, and then that works out pretty well. Now there are national companies. Now I asked one driver one time, who's an independent driver, I said, "Do you belong to a consortium?" He said, "Yes, I do." I said, "Well, how much do they charge you, if you don't mind me asking?" He said, "I believe it's about $1,800 a year." And I'm like, "Whoa!"
Wow. Oh my.
And I said, we can do that for about $300-400
Yeah.
or less, depending on the number of drivers. And a lot of our companies, the larger companies, if we have a contract with them, we offer it to them at a discounted rate on top of that. So, we're willing to bend over backwards to help any company
Right.
with any need. If they have a need, then between what we have affiliated with OccMed for DCs, we can supply that need.
Excellent.
If you're a company and you have a need for DOT exams, a need for breath alcohol testing, a need for drug testing, a need for a consortium. On top of that, there's other services, like if your employees are required to wear a mask, a respirator. We do the OSHA fit test questionnaire, the pulmonary function testing, and the fit test for the mask. Now, I haven't gotten into the qualitative one, but I do I'm not sure which one's which. I did do the one with the smoke.
That is qualitative.
I do the qualitative. So there's a quantitative, some masks, some company
They use a
contracts.
device. They use a machine
Yeah.
to do it.
Now, I don't do that one
You
yet.
can do manual, qualitative, or machine, which is quantitative.
Yeah.
Some companies are requesting from our doctors to do reasonable suspicion training. And reasonable suspicion training is a great way for a doctor to build a relationship with a company. And so this is a 1 or 2 hour slideshow that you would do a PowerPoint with. And do you do that for companies as well?
I have not yet. I've got a guy that's been really great working with me, helping me with some of my internet and outreach things, YouTube and stuff like that. I'm going to have him begin to reach out to companies and talk to them, and maybe even offer some of those types of services.
OccMed for DCs has that training already.
Yeah.
All he has to do is use that same script. And this is authorized by the National Transportation Safety Board and by FMCSA, which meets the requirements for reasonable suspicion training for all owners, managers, and supervisors that work in companies. That's a critical element of your business. If you don't have that, and OSHA comes out and does an inspection on your company, you are going to get a little ticket for that. You're going to get reprimanded. If you don't have a document signed by someone that's done reasonable suspicion training.
Yep, and there are some additional types of training and requirements that some of our employers have asked for relative to getting a certification for their work comp. And if they do that, then they get a discounted rate for their work comp insurance as well.
This brings me into another question, and this is one of the biggest items on the list for employers and companies are recordables. Recordables, that is the buzzword of the century, is, man, my work comp rates are killing me because of my recordables. What does that really mean?
Well, basically, OSHA requires an injury that meets certain criteria to be recorded in an OSHA, I think it's a 100 or 300 OSHA 300
form
log.
300,
And so that's a requirement for them to do that. So one of the benefits of working with a chiropractor is, let's say an employee is cut. Now, I can do first aid in my office. And if I come in and apply a steri strip and maybe put a little bacitrate ointment and wrap that wound, then that's first aid, which is non-recordable.
Yeah, and so you're able to do a minor amount of triage, as we say,
Right.
to help that employee. Now, I do know that if that same employee went to the emergency room, what's going to happen then?
They're going to end up getting a shot and a stitches
Probably stitches,
and a prescription, typically.
probably antibiotics,
Right.
and probably pain medicine.
Correct.
And they may say, well, you know what, let's take you off work for a week.
Right.
That's an automatic red flag for a recordable right there.
Absolutely.
If they're not taken off of work.
Yeah.
Whereas I know in your office, what you do is you work with the employers and you try to find a way to get them back at work and keep them working,
Absolutely.
and so that they can heal and in a timely manner and take care of those little issues, which can reduce the recordables considerably.
Yeah. I'll give you some other examples. We see a lot of we've seen a lot of burns in the past, and you know you'll come in and they might have moderate level second degree burns with blisters. I can do a little first aid, kind of trim that up, put some of the gauze that it provides a healing for them, wrap it for them, and check them back maybe in a week, make sure it's healing correctly. Again, first aid, not recordable.
Right.
The cuts, objects in the eye, most of the strains and sprains. The benefit of utilizing a chiropractor is that all chiropractors, really by law, don't wish to prescribe drugs. And so you're going to be able to have an employee come, get some basic first aid, get some help, get some, we can do everything, including x-rays if necessary, to check for broken bones. Now, if it's a broken bone and it can be splinted in first aid, that's different from a fracture that's got a bone protruding through the skin. That's one that you probably wouldn't bring direct. That's an injury that probably would not be brought to a chiropractic office.
But you could make that decision if someone comes in. You're going to say, you know what, this person needs to be in the emergency room.
Right.
And so you're able to make that call. We get calls like that from companies all the time. And they'll call me on the phone and say, hey, Doc, we had one of our employees fall, and we're not sure whether we should take him to the emergency room or bring him to you. And the first thing I asked him, I said, well, where did he fall from? They said, well, he was just stepping up on the curb and he fell over. Or no, he fell off of a 3-story building. Well, here's your sign. If he fell off a 3-story building, he probably needs to be in the emergency room. If he tripped and stumbled and fell, bring him in here. Let me look at him. Let me make a determination whether he can return to work, and we can bandage him and do first aid. And so that has worked real well with our companies to save them money and reduce those costs. And so they're able to work out a relationship with the doctor financially to provide that level of service. And we call it sub-workers comp before it becomes a workers' comp claim. And they really appreciate that.
Yeah, one of the keys is we found that working with a chiropractor, you can also do types of ergonomic preventative training, how to lift classes and some other things. If your OSHA 300 log shows that you've got a particular area that has a lot of injuries, then maybe we need to do some pre-employment testing.
Like back strains.
Yeah, make sure you're hiring the right person. We can do some national back fitness testing that can basically quantify the predominant likelihood of that person getting hurt. Muscles out of balance are more predisposed to injury. And so I'm actually part of a national safety certified Back Power Plus program, where we do a program called Back Power. It's a simple back test that measures core muscle balance.
Right.
And there's a really great strategy that you can implement for a company that has a lot of back strains. You can test all of the employees and see where they grade out, and those that grade out in a poor score that might be more likely to hurt themselves can be given the tools and the stretches and the exercises to do at the job site to prevent an injury.
Right.
And if they're currently hurt, then there's simple things that we can do to work with them from a therapy standpoint to get them lined up and balanced that will allow them to get back to work quickly. And if they're safe, they have the tools. If something happens, one of the biggest concerns that I've heard from some of the companies I've worked with is Billy Bob's been out fishing all weekend and he comes to work on Monday and we think that he did something lifting his boat up on the trailer and he's now reporting a job injury. How do we know that this happened on the job? Well, if you are doing little group stretches in the beginning as a part of the work, many companies are doing that now. They'll gather together. They'll have like a little powwow or a little safety talk, and they go through a few little brief stretches. And if you see Billy Bob can't bend over and touch his toes like you want him to, maybe you need to ask him, when did you hurt your back? And this is before he even starts his shifts. So there's a lot of different strategies that we see that can be really helpful to work with employees. One other thing that I found too, working with companies, is that if a company has a fair number of injuries and that they find that a large proportion of those employees are hiring an attorney right off the bat, there's a problem usually with the supervisors not treating the employee what the employee feels is fairly. And so sometimes we have to implement supervisor training as part of the educational process of how do you deal. Most employees that get hurt on the job, they're just concerned about the lack of income. And they really want to get back to work by and large. They're not trying to pull the wool over somebody's eyes. They want to get back to work.
Right.
And so we try to evaluate them and assist them and work with the company to get them back. We found that if you keep an employee out of work, the longer they're out of work, the less likely they are to go back to work. But if you communicate with them properly and you treat them fairly, they're less likely to go out and hire an attorney as well. Right. So that's important as well.
You know, too, this leads me to the next thing. And I believe in an ounce of prevention is worth a pound of cure.
Absolutely.
In that you're doing the pre-employment physicals, what we call post-offer pre-employment physicals for employers, helps to save them problems down the road. There are some employees that you just don't want to hire. There are some employees that don't physically qualify to meet the physical demand levels of the employer. And so what we want to teach our doctors in OccMed For DCs in our network, you already know this already, but that employee has to meet the physical demand levels of what that employer needs in a job. For example, that employer couldn't hire me to build scaffolds or to climb a ladder. Doc, I'm sorry, but you're just not fit for that job. And so by having these pre-employment physicals, you're able to prevent these recordables from happening in the first place. You know, and everybody wins when that happens.
Absolutely. And one of the requirements, you know, they passed this law, I think it was in, I want to say 80, when I can't remember exactly, 84 or something like that. It might have been after that. The American Disabilities Act was passed. And so it almost stopped all pre-employment exams for a period of time. Mm-hmm. And basically, an employer can't do the exam. And the reason is because if you deny a person a job based on an actual or perceived disability, you're in violation of federal law.
Right.
And so, but you can use a third party like an OccMed For DCs qualified doctor to do pre-employment exams because they're collecting the information and it's part of the tools. And if we find somebody that doesn't qualify for the job.
For example, if they've had 3 back surgeries and
right.
they've broken their ankles twice, is that the right person to do the kind of work that employer needs to have done? And well, you can address that.
If they're a material handler and they're bending over and pulling objects out of a crate, probably not. They're going to re-aggravate right. themselves. So we have to make that assertion of whether they're qualified to do the job. Now, one of the things that we found is important is that if you're basing it on some test, the test has to be directly correlated to the essential functions of that job. Many jobs could be have reasonable accommodations, but in many instances, those are not available. Sometimes the essential function of the job is you got to bend over and get this thing over and certain aspects of the job that's physical
For,
demands.
for example, if someone is blind in one eye, would they qualify to drive a forklift?
No.
If they're in a warehouse and pulling things off of, and they're having other forklift drivers around them? And see, we had this happen. We had an employer that asked that we were doing their drug and alcohol testing for them, and I said, why don't you let us do your pre-employment physicals? Because I can guarantee you there are probably some people that you shouldn't be hiring. And we're doing a lot of you're getting a lot of new hires coming in here and your company's growing. And he said, okay, we'll start doing that. And they started sending them in, and sure enough, we got the guy with the blind eye, and he said, I'm a forklift driver. And we said, you don't qualify to drive a forklift with one eye, because it's just too dangerous when you have no field of vision on your left side of your body. And so that saved them a potential dangerous work environment. Or someone's lost their hearing, and if they don't have hearing aids, well, that could be a problem on a job site where they're having to operate a crane, or they're having to move dangerous equipment around when someone is backing up a truck and they can't hear them coming with the beep, beep, beep thing, So there's a lot of reasons employers need to have that pre-employment physical to help save them from someone getting hurt.
And it needs to be done by a third-party group outside.
Right. So if they decide to do that, then they'll be liable.
That's right.
And maybe potential lawsuits for discrimination or whatever. But if you let us do that, the doctors, then we can make a decision based on evidence-based medicine, based on your skills and training, that this person doesn't meet a physical demand level without that issue of liability.
That's right.
Okay.
What were you saying?
It's 12:30.
Yeah, we haven't gotten anything to eat, but we'll.
All right, we good?
What you hungry for?